My name is Chiara Salim. I was born back in Jakarta, Indonesia, and I'm currently living in Tallinn, Estonia. Just a few months ago, I moved to Tallinn, Estonia. I got lucky. I believe it was a good opportunity that I got a job opportunity here in which that it makes me able to get the government healthcare insurance. And in here, psoriasis is considered as something important. So all of my treatment here is actually covered by the government. It wasn't a difficult process at all. And so currently, I got my biologic injection here in Tallinn, Estonia, and every month covered by the government 100%. And I just need to pay for €2.5 out of my own pocket. My meal is even more expensive than that. So can you imagine? I was diagnosed when I was just 9 years old, back in 2008. When I first got diagnosed, because it was already spreading throughout my body, just as a little kid, I couldn't really comprehend everything that was going on. So I think I reacted through having comfort in knowing that I have to do all of these steps to make myself better. Only then, after a while, I realized that I was different from the people around me, from the people my age, like my friends. And this is something that is going to stay. And that slowly, I think, killed the confidence and the self-esteem that I used to have. And it was just devastating, in short. For the first 10 years of my life with psoriasis, I lived in a victim mindset. I didn't dare to have any dreams. I didn't dare to go out and socialize outside of school. It limits me in every way, and I think my coping mechanism was just pretending that everything is okay. Everyone would tell me that Chiara is so cheerful, even though she has psoriasis. But then there were a lot of moments where I would just cry myself to sleep. I didn't want to go out. I avoid attending like birthday parties, meeting new people. When I started biologics, it was something that is very, very financially consuming, I would say. And I always felt guilty, but when I started working, I also got my company's own insurance, which helps a little bit towards like probably a few months supply. But then for the rest of the year, we would still need to be able to pay it out of our pocket. And that was like a big, big privilege for myself in living in Indonesia, being able to afford that, because most of the psoriasis patients in Indonesia do not have that privilege. They are not able to have access to that, and so they have to live through with psoriasis, manage their psoriasis in other ways which aren't always so effective. There are government insurance in which it has the options for biologic injections, but even then, getting through there is a long process and long journey to go. There was just a lot of hassle in getting access to healthcare in Indonesia. And even if it's not a biologic injections for, let's say, oral treatment or creams, they would just give you a few weeks of supply. Psoriasis is a lifelong condition. We cannot just simply get a few weeks of supply and then every few weeks we have to get back to the doctor, go through the same process, wait the long time that it takes, and then hope for to get the approval to get more of the medications. Aside from it being expensive, we have to be proactive in asking the questions. Outside of it, also in rural areas in Indonesia, there are still a lot of doctors who do not even know about psoriasis. So getting diagnosis in the first place is also a challenge. I once met this pediatrician because I had to test for TB before starting my biologic injection. By then, my psoriasis was all over my body. It was erythrodermic psoriasis. And she insisted throughout the process that this is just an allergy. I tried to tell her, no, this is psoriasis, it's a autoimmune condition, this is how it works. But she kept insisting that, no, your doctor is just lying to you. You just need to take some allergy meds like antihistamine and you'll be good to go. She just kept on insisting, and I was like, I was trying to convince her too, but then at the end of the day, I'll just let you think what you want to think. So there's definitely a lot of gaps in the healthcare system and the quality. People in rural areas, they have bigger struggle to make the people around them understand about psoriasis, because it is not a widely accepted idea that there is such condition called autoimmune disease. It's like you're autoimmune attacking yourself. That is such like a very foreign idea. To let them know the fact that yes, they have psoriasis, but they are able to live hand in hand with psoriasis and still living their life. It doesn't have to stop them. It doesn't have to limit them. It's to empower them knowing that they can do something about it and they don't have to live in pain. I started sharing my story through a blog when I was in high school, but it was just merely as an outlet mostly to let out all of my pent-up emotions, should I say. And that becomes some sort of a habit to be more open about psoriasis. And when I started my self-healing journey back in 2019, I started to even further share through social media, especially Instagram. It was just as an intention to help myself in the beginning. I remember that I was going through another flare-up when I was off with my biologics, and I have been just feeling really down and feeling in the dark with it. And one day I was like, okay, let's get a move on. I have given myself enough time to be sad, and it's time to get back up. I took my phone, I took a tripod, and then I was like taking pictures with my skin to make myself feel better. You know how making yourself smile can like help to lift up your mood. And I was like, I posted that picture with some like self-love quotes as I was like journeying through my life and learning how to be more comfortable with my skin. And that went sort of viral, and that made me realize how important it is to speak up about psoriasis, because this makes a lot other people with psoriasis who are hiding in the dark too feel that they are represented. They realize, they learn that they are not alone.